Hello again, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, bringing you today on January 11, 2021, the 86th edition of our COVID-19 community briefings. We'll just start out right away today with our local scoreboard. Over the last week, we have done 153 tests here at the Orange City Area Health System, 34 of which were positive. And so that's a 22.2% rate. It compares to the previous two-week rate number that I gave to you of 14.5. So it's up a little bit, but again, with the number of tests that are starting to be of lower volume, you kind of have to weigh everything together. So let's just accept that number for now, and then we'll talk about the rest of the numbers. So 34 of 153 over the last week, a 22.2% rate. And overall, if you're keeping track, we have 1721 positives out of 8,434 for a 20.4% rate. Okay, so again, that's one of the data that we just have to sort everything out. Stepping up then to Sioux County, our 14-day average, and of course, we're in the range now of how did Christmas work, how did January 1st work, New Year's Day, and how is that playing out? It's playing out actually that there's been a little bit of an increase, but not a lot. In Sioux County, the 14-day average currently, as of today, was 18.0%. The last time we spoke last week, it was 15.5. So we have had a little bit of a spike, but nothing too big. The 7-day actually has decreased. The 7-day average for Sioux County is 12.5, and last week we reported the 7-day average being 13.3. So that has gone down a little bit. When we look at the positive rate for individuals over 100,000 population over the last 7 days, we have a number of 275.0. That is actually down 24% over the previous 7-day period of time. And we'll compare that to the state number here in just a little bit. We have had 102 additional positives in Sioux County over the last week. And again, one of the indications that this still isn't over, people are still testing positive, people are still getting the virus, with 102 new positives this past week in Sioux County. Region 3, the hospitalizations in the 20 county area here with COVID-related diagnoses is at 91. That number last week was 83. So about a 10% increase in that hospitalization mark. The number of patients in the ICU has gone up as well, from 13 to this week, today, 20. Of those 20, 6 people are on ventilators. That is the same as the week prior. In Iowa, as a state, our 14-day average is 14.6. That is up slightly from 13.3. The 7-day average is 11.8, down slightly from 12.0. The individual positive rate per 100,000 population is 335.4. That's actually a 0.4% increase at the state level on a per population basis. Then when you revert back to where Sioux County was at 275, you see that our county rate is a little bit less than the state rate as a whole, which 6-8 weeks ago we weren't saying that at all. We were kind of leading the pack, unfortunately, in a number of areas. But our numbers in Sioux County are much better, slightly below state trends, or at, for example, again, our 7-day average in Sioux County is 12.5, where the 7-day average at the state is 11.8, so pretty close there. And so overall, things are relatively stable and relatively quiet at this point. When we look at Iowans who are hospitalized somewhere with a COVID-related diagnosis, We have 541 of those individuals. The number that we reported, the last time we reported this number was December 28, and that number was 651. So, maybe a 20% decrease in that number, which was, 20, 30, 40% less than times before that. So again, the hospitalizations across the state from COVID related diagnoses is going down. Currently, officially on the coronavirus.iowa.gov website, Sioux County has 3 residents who are hospitalized somewhere. Currently in Orange City, we have 0 COVID-related inpatients. An indication that the virus is not over and we're still on this marathon, this journey, is that our death toll continues to climb in the state. It grew last week by 146, bringing the total deaths to 4,138 at a statewide basis. Sioux County, the official number is 48. So 146 additional deaths this past week. The demographic of those patients, those people have not changed at all. We're at 94% of those deaths are age 60 and above. 59% of those deaths are 80 and above. So clearly that demographic is the most vulnerable, as it has been throughout the course of this virus. I want to switch now over to just a couple of things. We had the briefing last week specifically about the vaccine. That's continually changing. And one of the things I want to point out is eligibility versus availability, because it's kind of deceiving when you hear about New York, for example, making 1B residents eligible to receive the vaccine. What you're not hearing, and that's being reported in some of the trade journals that I've been reading, is that those eligible people will not be receiving the vaccine for at least 3 months. And so I think that's a little bit misleading to hear news reports about eligibility when vaccine availability simply is not there. So they have the ability to put people on a list, but they don't have the ability to give them the vaccine that in some cases is sitting on a shelf. So Iowa, fortunately, is not in that situation, but you got to be careful when you listen to some of these national reports about eligibility and availability. They are 2 very different things. In terms of phase 1B being available here in Iowa, and that we don't know yet when that is, but no one is expecting that to be prior to February 1. So we're at least 3 weeks away from that. And as I may have mentioned before, once we get into 1B, we are talking about thousands of people in Sioux County being eligible. And so it doesn't do any good when we get dosage allocations in 10s, 20s, 30s, or even hundreds. We need dosage allocations in terms of 1,000 or more to be able to effectively meet the need. And so I don't want to create a whole bunch of 1B eligibility to people and give the impression that vaccine is available when it's not. And so we will be prepared and are prepared to administer vaccine in significant quantities. And we've talked about that as a hospital and healthcare coalition in the county. We can do significant immunizations in the thousands if we simply had the vaccine to be able to do that. And so we expect here in Orange City to run out of our current allocation sometime this week. And again, we're largely in the 1A thing, in the 1A category, as we are required to be. If we have an open vial, we are being told to give that to eligible 1B people. And we are doing that based on our assessment of folks like independent living residents, pioneer home residents, elderly population in congregate housing kinds of things, which nobody can question are at higher risk. But again, that's only with extra doses. It is not about going out and setting up clinics for those people. A bit of good news, we received this morning a notification at about 9 a.m. that the second dose allocation are being sent currently. And so Sioux County is expected to receive about 900 follow-up doses. Now it's the same vaccine, but it is to be set aside for those second doses. So we'll be able to do that. That allocation should be adequate to cover all of the initial doses that we gave, which probably in about a week to 10 days, maybe 2 weeks, are going to come due again. And it is not that it has to be given on the 28th day in Moderna's case, post initial injection. It's just that it can't be significantly prior to that. So if it's a week later, a month later, it's probably just fine. I've been told that's the case. So it doesn't exactly have to be on day 28. As long as it's not prior to the 28 days, you're in pretty good shape. But the second dose is required to get to that 95% effectiveness. So good news, we're going to be carrying through with that. We received notice that we will be receiving that. But again, we can't use those doses for initial vaccinations. We can only use them for the booster, so to speak, that second dose. I just want to also let everyone know that we have a task force that meets every Monday that talks through issues of what's going on. Are we going to be able to open things up here a little bit? Visitor policy, all those kinds of things. And we're being a little hesitant right now, just because in part the vaccine process is going slower than we had hoped, but also because we're in influenza season now. And it's going to be a little harder to sort through the flu versus COVID. Symptoms are going to probably be somewhat similar. The spreadability, so to speak, of the virus is not unlike COVID, the influenza virus. And so we want to be really cautious with that. And we're going to be slower to open things up than not. So if you're wondering what's going on and how come we haven't kind of changed our visitor policy or things like that, it's largely because we're keeping an eye on what's going on with flu also, and we don't want to open things up and then create another problem in another area. So the last thing that I have today is our Test Iowa clinic is still operational and still functioning Monday through Friday mornings. We're seeing on average about 10 a day in that clinic. We will run the Test Iowa clinic through the month of March, and then evaluate where we're at after that. But for the foreseeable future, for the next 10 weeks maybe, we'll have Test Iowa where it is, and you can contact Occ Health if you need instructions with that, testiowa.com also. And so that will be running through March at least at this point. So that's going to be it for today. Again, we're not through this thing yet, but we're breathing a little bit easier, so to speak. We're continuing to monitor the situation very closely. It really today is mostly about vaccine. And when you get into that world, mostly about supply. We are giving the vaccine as long as we have it. The issue is getting it. And so that's a little bit frustrating. It's more than a little bit frustrating, but that's where it's at. That's what we're doing. And that's really what we're focused on. And we continue to try to advance the ball as much as we can at this point. So again, my typical sign off, stay strong, stay vigilant, and stay healthy. We will be looking at weekly briefings again, unless something happens that we feel we want to communicate right away. So in lieu of that, we'll expect the next briefing next Monday. Thanks for joining us today.